Minnesota just issued a new budget forecast. It's always a best guess about the future of the state's economy, but changes to Medicaid and demands for change from the Trump administration are compounding the state's economic uncertainty. This is Hospital Matters, a podcast from the Minnesota Hospital Association. We're having conversations about issues impacting hospitals, health systems, and patient care in Minnesota. I'm Tim Nelson. The administration of Governor Tim Walz has issued its second to final budget forecast, a roadmap to the upcoming legislative session. Minnesota's economy has picked up slightly since the last outlook in November, and some of the gloom from that forecast has lifted, but more may be moving in. Minnesota Hospital Association Vice President Bob Hume, a former senior Mark Dayton gubernatorial staffer, and MHA Vice President for Fiscal Policy Joe Schindler have some thoughts about what may lie ahead. There's a new budget forecast out from the state. The top line here is experts are projecting a $3.7 billion budget surplus. Although most of that money is expected to go away, the state's expected to be left with about $377 million next year when it starts writing another biennial budget. Now, most of the time, this is about as exciting as watching someone balance their checkbook. But since 2023, when the state had that big $19 billion surplus that set off a whole legislative frenzy, these forecasts have been the subject of great interest. Normally, these are considered nonpartisan projections, but they're, of course, developed by an elected administration. So I'm going to start with you, Bob. You've had an inside look at these forecasts. Are these numbers real?
Yes, Tim, very much so. And there's three things that folks generally don't think very hard about in understanding what a budget forecast is and what it isn't. And you are correct that it is much like watching paint dry, because the people who do this work in the government take it very, very seriously. So there was a time not too long ago where the biggest secret in town was what this budget deficit number would be. And when I was working in the last gubernatorial administration, we would all get up at 4 o'clock in the morning and go over to the governor's residence to hear first what these numbers were. And then legislators and the press and everybody else would try to figure that out. Somewhere along the way, they decided that what they would do is put the numbers out in the morning and then explain them in the afternoon. That's caused, even more uncertainty because people are trying to guess from the top line down. But there's three things to remember about the budget forecast. First, at the very end, it's not just a number, it's a permission structure for the rest of the legislative session. It's about political oxygen. So the forecast for policymakers means here's a surplus, we can expand some things, here's a deficit, we should restrain some things, or things are flat and we should negotiate. But what politicians and policymakers hear is either red light and green light, because the state government does not have the option that the federal government does to just spend and spend and spend and then figure it out later. They have to balance that budget. And that has its pluses and minuses. The second thing is the law is built on a system that requires certainty from a model, an economic model that's designed to avoid it. So economists and budget professionals don't talk in sweeping certainty. They talk in generalization. So as a normal person, if you turn on the state budget forecast, you will see the release of a very highly technical and expertly done document, and then a 2-hour press conference that explains why we shouldn't take that as fact. So it's just all about, here are the risks, here's the structural imbalances and the outlook. It depends. And so for the normal person, what I think gets lost in this is that the opaqueness of the process, and particularly for folks who are working in hospitals and health systems, this is a quiet determination of pretty much every decision that's made on the state and local level from a budget perspective based off of this one document. So whether education expands or taxes are cut, that's all based on this math. And for us, it's a window into whether we're going to be able to work with legislators to address some of the massive underpayments in public programs that are driving up costs for Minnesotans. So it is as confusing to watch as it is to read, but it matters very much. And we all need to pay very close attention to what it says.
Now, you called this a red light or a green light. Do you have a feeling about which one this is?
Well, I think this one in particular is very much a red light because the explanation of the budget forecast was that in November we were facing a multi-billion-dollar deficit and now we're facing a surplus, but that money doesn't really exist because the state spending commitments going into the out years exceed the revenues that are coming in, which is called a structural imbalance. So what that means is in next year's budget session, in which we'll have a new governor and a new legislature, they're going to be facing some very, very difficult decisions as they're trying to get whatever it is they're elected on this fall off the ground.
Now I want to bring in Joe Schindler here. He's the Minnesota Hospital Association's Vice President of Finance Policy. Watches these things very carefully. There's a couple things going on here. One of them is this isn't happening in a vacuum. CMS announced this week that it was clawing back or withholding $259 million in Medicaid to Minnesota and suggested that Minnesota could make up the money out of its own bank account. So that really isn't in this forecast. Neither is the impact of HR 1, which is probably going to start hitting the state next year. You monitor this all the time. What isn't in this forecast? What aren't we seeing when we look into this crystal ball?
Yeah, well, that's a good question, Tim. And first and foremost, I would say is the way we look at these budget forecasts twice a year is sort of as a risk assessment. Where are we at just directionally at the state level? Keeping in mind that not everything is necessarily embedded into the budget quite yet. Specifically, when you're talking about some issues about Medicaid deferrals that we just heard about from CMS this week, $259 million. That's a potential risk, although from what our discussions have been with DHS, largely if they can substantiate what they spent that money on, we should be fine. But HR 1, for example, whereby the federal government is proposing to enact greater restrictions on the Medicaid program by having twice a year redeterminations for Medicaid folks and also work requirements. That's going to require some state spending to reinforce our IT systems to be able to handle that workload. Right now, the state of Minnesota is estimating that as many as 140,000 Medicaid individuals could drop off the Medicaid rolls. Now, if you look at the state budget, you would say, well, wait a minute. If there's fewer people on Medicaid, that means less spending for the state. Now, there's less federal money coming in, but that's less spending by the state. On the other hand, as I just mentioned, the state is going to have to spend money to get their IT systems up to speed to be able to handle these redeterminations and these work requirements that are additional administrative costs to the state. So will that ultimately end up in a net? We don't know at this point in time. And the state is a little unsure either what those total costs look like.
Now, we've had some experience in the recent past regarding the state covering people who weren't covered by federal Medicaid. In that 2023 session, lawmakers decided to offer some coverage to undocumented individuals, which the state picked up, although that was rescinded for adults in the last legislative session. Do you foresee that this forecast would allow something similar for people who are falling off those Medicaid rolls as a result of HR 1? Is this the kind of budget that would allow the state to sort of make up the difference for those 140,000 people going forward?
Well, the good news is the budget has improved since last forecast. So that's a positive. But as Bob pointed out, there is a structural imbalance, meaning there's more spending than revenues coming into the future. So the state still has to solve for that conundrum going forward. Otherwise, what looks like a positive surplus into the out years will quickly become a negative. So is there some funding available in the short term to cover some of those folks that fall off Medicaid? Potentially, but that's not a good long-term solution. You can't fund the program on state-only money.
It is a lot of money.
Right.
So looking forward, that may not show up in the state budget. How is that going to impact providers and hospitals in Minnesota?
Well, HR 1 itself is probably provides the most significant impact on providers, more so than even the state when you look at hospital provider budgets. If Medicaid are a significant share of the payer mix of many hospitals, and if folks are falling off the Medicaid rolls, that means that they're going to lose coverage altogether. And where do they go if they lose coverage altogether for medical care? If they need medical services, there's only one or two places they can go. FQHCs for clinic work, and they can go to hospital emergency rooms for the most part. And so we estimate that hospitals are going to absorb the vast majority of HR1 cuts related to the Medicaid redeterminations and work requirements simply because of that fact. In fact, we've estimated loss to hospitals on an annual basis, and this is conservative, but on an annual basis, it would be a loss of $269 million, not to mention the $350 million lost Medicaid revenues that would have been there had these people had coverage.
So a lot of money going forward.
Correct.
And again, that's not showing up in the forecast. That's not showing up in the state budget because that's not state money.
Right. Exactly.
Well, there'll be another forecast out in November. As we all know, it's a semi-annual holiday for budget nerds. So hopefully we'll have a little better news come fall. Again, this has been a conversation with Bob Hume and Joe Schindler, both vice presidents at the Minnesota Hospital Association, talking about the Minnesota budget forecast released last Friday. I'm Tim Nelson, and you've been listening to Hospital Matters from the Minnesota Hospital Association. Join us next time for another look at issues impacting hospitals, health systems, and patient care in Minnesota. Thanks for listening.